Hello everyone, welcome to MSK Ultrasound Shorts. A 48-year-old female presented with complaints of loss of flexion at interphalangeal joint of left thumb. She gave history of injury to her hand about 8 days back following a quarrel with her neighbor. There was also swelling and bluish discoloration of the left forearm. On examination, there was loss of active flexion at interphalangeal joint of left thumb. Passive flexion was possible. A large ecchymotic patch was noted over the flexor aspect of left mid-distal forearm. Wrist movements were normal. So considering the history, definitely there was some pathology affecting the Flexor Pollicis Longus tendon. So I started scanning FPL tendon. This is the image of Flexor Pollicis Longus tendon within the proximal carpal tunnel. The tendon looked quite normal with normal echogenicity and looked intact here. This is the image of Flexor Pollicis Longus tendon in the palm. Longitudinal image nicely showing the tendon. This is the axial image of FPL tendon in the palm. Some minimal fluid was seen within the tendon sheath. And this is the FPL insertion at the base of distal phalanx of left thumb, which also looked pretty normal without any evidence of avulsion or tear. So, where was the pathology? FPL tendon was definitely looking intact throughout its course, right from its insertion onto the base of distal phalanx up till the carpal tunnel. So I started scanning proximal to the carpal tunnel, and these are the axial and oblique sagittal USG images of distal forearm. A hypoechoic tear was noted along with intramuscular hematoma within the FPL muscle belly at myotendinous junction. It measured about 2.2 cm in length and 0.5 cm in width. On dynamic evaluation, that is passive flexion and extension at interphalangeal joint of left thumb, there was movement of Flexor Pollicis Longus tendon throughout its course in the palm as well as in carpal tunnel. However, no corresponding contraction was noted within the muscle belly, suggesting that it is a zone 5 Flexor Pollicis Longus tendon injury. So, on the basis of high resolution ultrasound, we could answer what was the lesion. It was FPL tendon injury. Which type? It was in zone 5 injury, quite a rare kind of injury. And location, that is, it is involving the myotendinous junction. So in experienced hands, high resolution MSK ultrasound is very cost effective, allows concrete diagnostic information. Most importantly, it allows dynamic real-time assessment, which is not possible with MRI or any other imaging modality. It has got higher resolution. This is another bonus point than MRI. 150 microns as compared to 460 microns at 1.5 Tesla and 200 to 300 microns at 3 Tesla. It allows vascularity assessment without IV contrast. Simultaneous comparison with the opposite side is possible. There is no obvious contraindication and can be safely done in claustrophobics, pediatrics, patients with pacemakers, metallic hardwares in whom MRI is contraindicated. Thank you.